Ligonier has another 13,000. I mean, just 5 doctors alone have 50,000 patients. What are we seeing? A delusion? We're seeing real live people in real life crisis with real live problems, and their lives are in turmoil. And I mean, it should be over. There should be no discussion about whether it exists. If you read the IDSA guidelines, I brought them along, I mean, you could throw up. And it sounds so good, you know, boy, it's impressive. But the conclusions that they come to eliminate every one of the treatments that I would use. Every single treatment that I would do, including antibiotics, they find ineffective. Okay, so here's some questions. The patient was diagnosed in November with Lyme disease, which seems to have progressed to gout. Is this possible? If you have a genetic predisposition for gout, I've found, and some of my colleagues, that it could certainly be a trigger agent for gout. And you probably want to be more aggressive on the Lyme side than on the gout side, because colchicine and indomethacin, although they help the symptoms, if it's still being driven by the spirochete, you really want to go after that. Is Lyme contagious in human contact, i.e. birth to baby? There is very good studies showing that the spirochete is placentally transferred to the fetus, cause of stillbirth, cause of developmental problems, congenital problems, and very important for a mother who has had Lyme in the past to have her OBGYN doc understand the severity of this and cover the patient with maintenance and prophylactic antibiotics that are not harmful to the fetus. There are a number of families. I've had about 15 or so in my practice, and all of the children were well and healthy, thank God, and all the moms were put on maintenance antibiotic therapy. So yes, you can be disseminated in an infected mom, cross the placenta, can affect the fetus, and sometimes have stillbirth or sometimes have congenital deformities, or as a child grows, you can start to get developmental problems. Can Lyme cause autism? Well, there is an association that believes just this, and I don't think Lyme's the cause of all autism. I think there are multi-variables, but certainly bacteriological infection like Lyme that affects the central nervous system can certainly be a player in an otherwise normal pregnancy. So yes, it can be a variable, an important variable in some instances, and there is an association that has a lot of literature on that. If Rhode Island is progressive in legislation, why is it not that there are almost no doctors in Rhode Island who treat Lyme? That's a mystery, it really is. I don't understand that. I really can't answer that question. I think probably they're kind of in the same league as most physicians. They take their information from the authorities that they trust. I mean, if you're a specialist in, say, urology, and you want to know something about Lyme, well, you would go to the Infectious Disease Society of America, and you'd go and you'd read the journals. You'd read New England Journal of Medicine. Well, they had a terrible article on Lyme disease, which I thought was very erroneous, very misleading, and yet, if I didn't know anything about Lyme and I would read that article, I'd be pretty satisfied that I was treating my patients correctly, and what I was talking to you about out there had nothing to do with Lyme. It was all psychosomatic, and you were a Lyme seeker. You were an antibiotic-seeking patient. ASP, that's what you are. And that's not the Society for Prevention of Cruelty of Animals either. What long-term consequences can one expect after one has Lyme received antibiotics and is Lyme-free. I think that if you are asymptomatic and you've been treated, then you can rest comfortably that the disease is in remission. Most bacteria, most viruses, practically all, never leave the system. We're great big streetcars. They're all in little cages: the strep, the staph, the pneumococcus, the diplococcus, the mycoplasms, all Epstein-Barr viruses, herpetic virus 1 and 2, HHV6. They're all there. They're all there. They're just locked in their cages, and immunologically they're under control. Lyme is no different. It's trickier. You got to be more careful. It's part and parcel of other co-infections. But if you recognize your symptoms and you have a good, sharp physician that can help you early on when you might be getting a relapse or a mild repeat, you should do fine. There should be no fear that some terrible untoward thing will happen to you. Our knowledge of long-term Lyme is still in its infancy. The best thing you can do is to be asymptomatic, decrease your stress, be happy, be optimistic. We found that works a lot. And don't be afraid. Lead your life fully, but understand that this is a serious illness, a lot of controversy in the medical field. There are two camps. My advice is to understand both camps and both arguments, and then make your decision. I would advise you to make your decision on the ILAD side, the International Lyme and Associated Disease Society, which have their own guidelines, but it would be something that would give you pause for reflection. Somebody here has chronic Lyme. Is it bad or fatal to use long-term antibiotics? Absolutely not. It's not bad or fatal at all. Long-term antibiotics are part of the staple in medicine. For example, tuberculosis is one example of long-term antibiotics without which the person will not survive, and they can lead quite productive lives. AIDS is another one now that long-term antivirals and antibiotics are part and parcel of keeping these people alive. Long-term antibiotics in Lyme, the maintenance particularly, I have, over the last 21 years, seen no Quasimodos walking into my office immune deficient, raging with other diseases, and practically moribund with a defunct immune system. I have seen the effects, though, of not treating the illness effectively. So I would say antibiotics used judiciously with awareness of the gut ecology are safe, and in some cases, about 20% of my cases in my practice necessitate maintenance therapy. Otherwise, they will often relapse. I wish it was different, but they lead productive lives with 2 capsules of minocycline every day, and I don't think that's a high price to pay for quality of life. Connection or misdiagnosis between Lyme disease and fibromyalgia. Well, fibromyalgia is really not a disease. It's a nomenclature, it's a syndrome for a group of symptoms. And many of the symptoms look like Lyme. There's no underlying etiology. It's an unknown etiology. It was a name that was produced by the Academy of Rheumatology in the late 80s when a lot of chronic fatigue was showing up and they didn't know what to do with it. So fibromyalgia came into the vocabulary, but it's simply a descriptive term. It's not a diagnosis. So I'm always suspicious of that. It doesn't really help